Okay, so we specialise in equine clinical nutrition. As a veterinarian, it's been one of my passions for many, many, many years. Seeing firsthand the role that nutrition can play in the management, prevention, and even the causes of so many things that our horses face, and we want to be able to help them with. This is a little bit about me, that I'm a horse vet. I went through Sydney Uni and did a specialist year looking at worm resistance, and then a PhD in foals, which is another one of my passions, is growing horses and pregnant mares. And then I worked in some universities in America, in Newmarket and Cambridge University in England, and was fortunate enough to see firsthand a lot of feeding situations at studs and trainers throughout the Middle East and in New Zealand and Japan and Turkey, South Africa. And I think the thing that I learned from that is that we've all got the same problems. It doesn't matter whether your horse is in Turkey or the UAE or England, they all face similar problems. And so we can help them with correct nutrition for a lot of those problems. My special areas of interest are developmental orthopedic diseases, which is all those twisted and crooked little leg problems we can see in foals. Colic, because it's such a horrible disease. And a recent paper put out by an equine surgeon in North America said, so he's just a specialist equine colic surgeon, and to him colic is largely a disease of management. So that's another one of my areas of interest, tying up and other performance problems. Laminitis is such a cruel disease, so anything we can learn and do to help our horses there is another one of my special interests. And that's why I began Jenquine, so that we can, you know, just sort of bring a veterinary clinical aspect to nutrition. Now we've got a range of products in our little stable, which we're all very pleased with and getting some fabulous results. And now we'll move on to our EzyMAG, which we've been really excited with the results we're getting for that. Magnesium has a lot of functions in the body. It's involved in over 350 enzyme pathways, especially for nerve and muscle function. And so the signs of magnesium deficiency, and when we're talking deficiency in this case, I mean, the calcium deficiency will cause frank clinical disease. Magnesium deficiency is more subtle, and it's subclinical in that you often don't know that it's there, because the horse doesn't, you know, get fractures or develop bone weakness and osteoporosis. But it does, you know, the signs that typically associated with a less than optimal magnesium intake are nervousness, excitability, twitching, you know, muscle sensitivities. It also Cushing's disease and insulin resistance, the metabolic syndrome, insulin resistance, magnesium has a role in the regulation of the insulin levels, and also how well the insulin is able to bind to the cells. So there's another paper, magnesium's high in bone as well, and there's a couple of papers now, and we always like to see a few papers showing the same results consistently, that magnesium, because it is involved in bone and joints, that if there's below optimum levels, they're at increased risk of osteochondrosis, which is one of the parts of the developmental orthopedic diseases. The requirements are also increased in aging horses during exercise and training, obviously because of the extra muscle work and the increase in bone density we're looking for. Lactating and cycling mares, and during transport and travel. We also have seen a few cases where the horses have collapsed from a low magnesium, and that's the extreme form. But when horses are grazing really fresh young pasture that's high in potassium and low in magnesium. So as I said, although you're not going to get frank clinical disease, there's a whole range of subclinical problems, many of which are responsive to magnesium. And we were talking about the calcium to phosphorus ratio, which is really important for bone. The calcium to magnesium ratio is of equal importance to muscle and nerves. So often the magnesium requirement is determined by the amount of calcium and phosphorus in the diet. And as I said, any borderline deficiencies just present with vague syndromes. But they're generally, and they should respond to magnesium supplementation certainly within 10 to 14 days, and that gives you an idea that that's been part of the problem that you're seeing. So when we made EzyMAG, because of its importance for exercising horses and breeding horses and young horses, there's another, and magnesium's commonly deficient in horse feeds and in horses' diets, and it's not all that palatable, so it's not usually supplemented at the levels required in manufactured feed because it does affect the palatability. The other important nutrient for those groups of horses, exercising, pregnant, lactating and growing horses, is vitamin E. And vitamin E intake has been shown to improve the colostral immunity, and so the mare can pass more immunity to the foals. It also improves responses to vaccination and the killing capacity of the white blood cells. And most of the requirements in the most recent NRC, which is now over 10 years old, the levels are below what's required for growing and working and breeding horses. So that's why we included the vitamin E, because the groups that benefit from magnesium also benefit, and again, most diets are deficient. And the vitamin B1 and B6, the research where they looked at done university trials and things on magnesium have included thiamine. So we pride ourselves on putting in the levels that have been shown to be correct clinically and to produce responses. As I mentioned earlier, we do take nutrition and what we put into the horses in the view of feed contaminants and analysed levels of nutrients very seriously. So we do use facilities that are licensed, audited a couple of times a year by the APVMA, which is the Australian Pesticides and Veterinary Medicines Authority, and they have quite strict guidelines on compliance and good manufacturing practice. The ISO is an international organisation which specifies standards for different human aspects of life, right through to baby's car seat, to bike helmets, and also to manufacturing of feeds for horses. So you can contact us directly, or look on the website as well.